lower extremity palpation video, Lab 9. Covers the anterior and medial thigh. The first feature has 3 parts. It is the femoral triangle. You will be outlining this triangle but not doing any muscle tests. We will come back to this after we cover the 3 borders of this triangle. Inguinal ligament forms the superior border of the femoral triangle. First, find the ASIS. Then have the patient lift their knee to create a crease. The inguinal ligament runs beneath this crease. The sartorius muscle forms the lateral border of the femoral triangle. Palpate this muscle just below its origin, the ASIS. To test, have the patient flex the hip and knee and medially rotate the leg at the same time. You should feel the sartorius contract. The adductor longus muscle forms the medial border of the femoral triangle. Palpate at the medial aspect of the thigh. To test, have the patient begin by standing with their feet apart, then have the patient drag their foot towards their other foot. The patient is adducting their femur, and you should feel the adductor longus contract. Back to the femoral triangle. This is a miscellaneous question, and you will be asked to outline this area. Inguinal ligament, superiorly, the sartorius, laterally, and the adductor longus, medially. Next is an artery, the femoral artery. You will be taking a pulse of the femoral artery. First, locate the ASIS, find the inguinal ligament, go to the midpoint, then drop just below and feel for the pulse. The next 3 muscles, tendon, and ligament will be palpated and tested with the patient sitting and with knees bent. The test will be the same for all as well. You will be asking the patient to extend their leg against resistance. The first muscle is the rectus femoris muscle. To palpate, find the middle aspect of the anterior thigh. To test, have the patient extend their leg against resistance. Next muscle, vastus medialis. To palpate, find the distal medial aspect of the anterior thigh. To test, have the patient extend their leg against resistance. Vastus lateralis. To palpate, have the patient in sitting position, find the distal lateral aspect of the anterior thigh. To test, have the patient extend their leg against resistance. The common tendon of insertion of the quadriceps muscle group. To palpate, find the base of the patella and go immediately up. Test, have the patient extend their leg against resistance. Patellar ligament. To palpate, find the apex of the patella and go just below. Have the patient extend their leg against resistance. This is the end of Lab 9, anterior and medial thigh.